Good afternoon. This is All India Radio. I am Valsa Williams and with me is Anuja Kumar with the Midday News. The headlines. First batch of DRDO's anti-COVID drug 2-deoxy-D-glucose released. Defence Minister reviews actions taken by Defence Ministry and Armed Forces in India's fight against COVID-19 pandemic. More than 18 crore 29 lakh doses of COVID-19 vaccine administered in the country so far. Over 3,78,000 people recover from COVID-19 infection in the country in last 24 hours. National recovery rate improves to 84.81%. Around 2,81,386 new COVID cases reported in the country in last 24 hours. In West Bengal, CBI arrests 2 ministers and 1 MLA in Narada sting operation case. Former mayor also arrested. In the Union Territory of Jammu and Kashmir, 2 terrorists killed in encounter at village Konmo in Srinagar district. Extremely severe cyclonic storm Taute likely to cross Gujarat coast between Porbandar and Mahuba tonight. In Uttarakhand, portals of Kedarnath Shrine open after winter break. And Taiwan imposes its toughest restrictions to battle spike in COVID-19 cases. As the number of COVID cases is on the rise, we appeal to our listeners not to lower their guard, follow all precautions, and all those above 45 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene. And now the news in detail. The first batch of the anti-COVID drug 2-deoxy-D-glucose has been released for COVID patients today. It was released by the Defence Minister Rajnath Singh and Health and Family Welfare Minister Dr. Harshvardhan. The drug has been developed by the Defence Research and Development Organisation DRDO in collaboration with Dr. Reddy's lab. The drug was approved for emergency use by the Drugs Controller General of India DCGI recently. Congratulating scientists of the DRDO for this remarkable feat, Defence Minister Rajnath Singh said this 2-DG drug is an important milestone in the journey towards Atmanirbharta.
ड्रग जिसका यह इजाद हुआ है, यह आशा और उम्मीद की एक नई किरण लेकर आया है। यानी हमारे देश के सामने यदि बड़ा से बड़ा चैलेंज आए तो हमारे वैज्ञानिकों के अंदर वह क्षमता है, वह ताकत है कि उसका मुकाबला वह कर सकते हैं। और जो यह ड्रग का इजाद किया गया है, मैं समझता हूं कि हमारे देश के वैज्ञानिकों की एक जो साइंटिफिक कैपेबिलिटी है, उसकी भी एक मिसाल है।
Mr. Singh added that it will reduce oxygen dependency by 40% in COVID patients. Talking about the central government's efforts in the fight against the COVID-19 pandemic, Mr. Singh said all the problems have been sorted out under the direction of Prime Minister Narendra Modi. He said there is no shortage of essential medical equipment, oxygen, beds or medicines. He added that the production of oxygen has been significantly ramped up in the country. He said the armed forces are making continuous efforts to provide essential help during the COVID-19 pandemic. Appreciating the efforts of the scientists of the DRDO and Dr. Reddy's lab for the development of this anti-COVID drug, Health and Family Welfare Minister Dr. Harshvardhan said this is the result of 1 year of hard work by the scientists.
1 साल से ज्यादा लंबी जंग में जहां भारत की तरफ से वैज्ञानिकों के माध्यम से वैक्सीन को डेवलप भी किया गया, वैक्सीन को देश के लिए उपलब्ध भी कराया गया, लेकिन शायद भारत के वैज्ञानिकों के द्वारा DRDO के सहयोग से हमारे आदरणीय राजनाथ सिंह जी के नेतृत्व में ये शायद हमारी पहली इंडिजिनस रिसर्च के आउटकम के तहत दवा है जो सीधे सीधे कोविड के वायरस के प्रकोप को पूरे वैज्ञानिक दृष्टिकोण से कम करने का पूरा पोटेंशियल रखती है.
Dr. Harshvardhan said this medicine has huge potential in preventing coronavirus growth. He said the government is continuously ramping up the health infrastructure in the country. He added that efforts are being made to set up pressure swing adsorption PSA plants across the country and the target would be completed within 2 to 3 months. Our correspondent reports that larger quantities of 2DG drug will be produced from the beginning of next month by Dr. Reddy's lab. The drug will be provided to COVID patients by the hospitals only. 2DG drug comes in powder form in a sachet, which needs to be taken orally by dissolving it in water. It accumulates in the virus-infected cells and prevents virus growth by stopping viral synthesis and energy production. Its selective accumulation in virally infected cells makes this drug unique. The drug has been developed by one of the DRDO labs, the Institute of Nuclear Medicine and Allied Sciences, INMAS, in collaboration with Dr. Reddy's laboratories. Results of clinical trials have shown that this molecule helps in faster recovery of hospitalized patients and reduces supplemental oxygen dependence. DCGI granted permission for emergency use of this drug as adjunct therapy in moderate to severe COVID patients. Being a generic molecule, an analog of glucose, it can be easily produced and made available in the country. Defence Minister Rajnath Singh is reviewing the actions taken by the Ministry and Armed Forces in India's fight against COVID-19 pandemic. He is chairing a meeting of Secretaries, Chief of Defence Staff, Service Chiefs and Ministry of Defence officials through video conferencing.
Health and Family Welfare Minister Dr. Harshvardhan has said that the country is witnessing a declining trend in the number of fresh COVID-19 cases. He said after the gap of 26 days, less than 3 lakh new cases have been reported in the country within 24 hours. He was speaking at the 26th Group of Ministers meeting today.
Today we have 35,16,997 active cases in the country. And for the first time after almost 26 days, we have seen cases less than 3 lakhs.
On the vaccination drive in the country, Dr. Harshvardhan said over 18.29 crore beneficiaries have been administered the COVID vaccine doses in the country so far. He said based on the deliberations made with the various stakeholders, it has been projected that the country would have procured 51 crore vaccine doses between January and July of this year. He further said over 2 billion doses of COVID vaccine would be available for the country by the end of December this year. He said this would be sufficient to vaccinate every beneficiary above the age of 18 years. India has administered more than 18 crore 29 lakh doses of COVID-19 vaccine in the country so far. Out of the total, nearly 14 crore 11 lakh people have been given the first jab of the vaccine, whereas over 4 crore 17 lakh beneficiaries have been fully vaccinated with both the required doses. The Health Ministry said that more than 6,91,000 doses of COVID vaccines were administered in the last 24 hours. The liberalized and accelerated Phase 3 strategy of COVID-19 vaccination has come into force from the 1st of this month, under which people in the age group of 18 to 44 years are also being vaccinated.
The cumulative share of active COVID cases in the country has declined to comprise nearly 14.09% of the total reported cases. The Health Ministry has informed that currently over 35,16,000 people are reported to be suffering from the viral infection and are either hospitalized or under home isolation. In the last 24 hours, the nation registered 2,81,386 new COVID cases. With this, the recovery rate has further improved to stand at 84.81%. Since yesterday, over 3,78,000 people have either been discharged from hospitals or are reported to have been completely cured. So far, over 2 crore 11 lakh people have recovered from the COVID-19 infection in the country. 10 states, including Maharashtra, Karnataka, Chhattisgarh, Delhi, Tamil Nadu, Uttar Pradesh, Punjab, Madhya Pradesh, Gujarat and Kerala continue to be the major hotspots of the viral pandemic. Nearly 75% of the new cases are reported from these 10 states. The Health Ministry has informed that 4,106 COVID-related deaths were reported in the last 24 hours, taking the cumulative toll to 2,74,390. The Health and Family Welfare Ministry has said that more than 2 crore COVID vaccine doses are still available with states and union territories to be administered to beneficiaries. The ministry said the union government has provided over 20 crore 76 lakh COVID vaccine doses free of cost to states and union territories so far. Of this, the total consumption of doses, including wastages, is over 18 crore 71 lakh. The ministry has assured that more than 3 lakh vaccine doses will be provided to states and union territories within the next 3 days. The Health Ministry has said vaccination is a crucial pillar in the fight against the coronavirus, and the third phase of COVID-19 vaccination has already started in the country. Indigenously developed Bharat Biotech's COVID-19 vaccine, Covaxin, has been found effective against coronavirus strains found in India and the UK. A study published in medical journal Clinical Infectious Diseases said that Covaxin has been found to successfully neutralize all key emerging variants tested, including the double mutant strain B1617 and B117.
The government has asked people not to share pictures and contact detail of vulnerable children in distress situation on social media. Their identity is to be protected as per law. Women and Child Development Minister Smriti Irani has said Police Child Welfare Committee or Child Line number 1098 should be informed if anyone comes to know of any child who has lost both the parents to COVID and has no one to take care of them. Talking to AIR News, National Commission for Protection of Child Rights NCPCR chairperson Priyank Kanungo said such children should be taken to Child Welfare Committee, which will take necessary action in the best interest of the child.
कोविड टाइम्स में जिन भी बच्चों ने अपने माता पिता को खोया है, उन सभी बच्चों को ये जरूरी है कि जिले की चाइल्ड वेलफेयर कमेटी के सामने प्रस्तुत किया जाए। वो कमेटी ही तय करेगी कि उन बच्चों को लीगली फ्री फॉर अडॉप्शन किया जाना है, उनके परिवार के साथ रखा जाना है, कैसे उनकी वेलबींग इंश्योर होगी। इसके लिए जो कानून से मैंडेटेड संस्थान है वो चाइल्ड वेलफेयर कमेटी है डिस्ट्रिक्ट की। अगर किसी भी व्यक्ति को ऐसे किन्हीं बच्चों के बारे में पता चलता है जिन्होंने अपने माता पिता को खो दिया है, तो वो 1098 हेल्पलाइन पर फोन करें, नजदीकी थाने में जाकर खबर करें अथवा चाइल्ड वेलफेयर कमेटी को बताएं।
An Indian Air Force aircraft has airlifted 3 empty cryogenic containers from Jamnagar to Al Maksoum, Dubai, for refilling of medical oxygen. Indian Oil Corporation Limited has coordinated for these containers, which will be filled up with liquid medical oxygen at Dubai and brought back by ship to India. The airlift will reduce the timelines of transportation of empty containers. The heavy lift transport fleet of IAF has been airlifting empty cryogenic oxygen tankers to their filling stations in India since the 22nd of April this year. The same activity is now being undertaken at international destinations. You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. First batch of DRDO's anti-COVID drug 2-deoxy-D-glucose released. Defence Minister reviews actions taken by Defence Ministry and Armed Forces in India's fight against COVID-19 pandemic. More than 18 crore 29 lakh doses of COVID-19 vaccine administered in the country so far. Over 3,78,000 people recover from COVID-19 infection in the country in last 24 hours. National recovery rate improves to 84.81%. Around 2,81,386 new COVID cases reported in the country in last 24 hours. In West Bengal, CBI arrests 2 ministers and 1 MLA in Narda sting operation case. Former mayor also arrested. In the Union Territory of Jammu and Kashmir, 2 terrorists killed in an encounter at village Khonmo in Srinagar district. Extremely severe cyclonic storm Taute likely to cross Gujarat coast between Porbandar and Mahua tonight. In Uttarakhand, portals of Kedarnath Shrine open after winter break, and Taiwan imposes its toughest restrictions to battle spike in COVID-19 cases. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
Welcome back to the Midday News. The Oil and Natural Gas Corporation Limited has been given the responsibility to procure 1 lakh oxygen concentrators on behalf of the Government of India. This step has been taken to help the country tide over oxygen shortage during the second wave of COVID-19 pandemic. The cost of procurement will be borne by the government. India's largest crude oil and natural gas company has informed that ONGC has placed the orders for 34,673 oxygen concentrators to overseas vendors for immediate supply. Of these, 2,900 are expected to be received by the 21st of May. The remaining concentrators will be delivered by the end of June. The Maharatna company said an order has been placed for 40,000 units of oxygen concentrators to domestic manufacturers to boost the domestic capacity. In Chhattisgarh, the Bhilai Steel Plant, a unit of Steel Authority of India, is playing an important role in the supply of medical oxygen needed for corona patients. Bhilai Steel Plant, commonly known for the production of high-quality steel, has become a troubleshooter by supplying medical oxygen in many states of the country. Union Minister of State for Steel, Fagan Singh Kulaste, said special arrangements have been made in the plant for uninterrupted production of medical oxygen.
भिलाई स्टील प्लांट से अब तक 24,000 टन से ज्यादा का लिक्विड मेडिकल ऑक्सीजन अलग अलग राज्यों को प्रदान किया गया है। शहर के सभी प्लांट मिलाकर के लगभग 55,000 टन से ज्यादा एलएमओ की सप्लाई कर चुके हैं।
In Nagaland, the first pressure swing adsorption PSA oxygen generation plant at Naga Hospital Authority Kohima NHAK became operational from today. The centre has allotted 3 oxygen plants under PM CARES Fund in Kohima, Dimapur and Mokokchung. Minister of Health and Family Welfare, Mr. S. Pangyu Phom, inaugurated the oxygen plant this morning. He said the plant will help ease the oxygen demands of the hospital, which will be supplied straight to the site of use through the medical gas pipeline. The minister informed that the PSA plant at NHAK has a capacity of 300 litres per minute.
Madhya Pradesh has reported a significant decline in the number of new corona cases. The state reported 7,106 fresh cases and 79 deaths yesterday, while 12,345 persons were recovered from infection. The recovery rate in the state is 86.10%. More from our Bhopal correspondent.
The number of active patients in the state is 94,652. The state's positivity rate declined to 10.6%. More than 200 new cases have been reported in 7 districts of the state, including Indore, Bhopal, Jabalpur, Gwalior, Ujjain, Ratlam and Sagar. The weekly positivity rate of 5% and below has been reported in 9 districts of Chhindwara, Badwani, Bhind, Guna, Ashoknagar, Jhabua, Khandwa, Burhanpur, Alirajpur. Meanwhile, the effects of a storm Taukte are also being assessed. Efforts are being made to ensure that oxygen supply of the state should not be affected due to this, and adequate storage of oxygen is being done beforehand. Pooja P. Vardhan, AIR News, Bhopal.
Tamil Nadu Health Minister M. Subramaniam has warned against people using steam dispensers at public health camps in central districts. Speaking to the media in Chennai, he said that this would spread the pandemic as people reuse the steam inhalation. The state today received 80 metric tons of liquid oxygen from Kalinganagar. This will be distributed to the hospitals in Chennai and other districts. The Telangana State Medical Services and Infrastructure Development Corporation has been receiving the global medical aid which the central government distributed among the states and union territories during the second wave of COVID-19 pandemic. The corporation has been sending the same to the major COVID hospitals in the state. State Nodal Officer in the corporation, Dr. Ram Babu Nayak, informed our correspondent that Telangana state received several medical equipments and vital medicines for COVID treatment from the central government. Most of these have been given to Gandhi Hospital in Hyderabad, which is a state nodal COVID-19 hospital, and Telangana Institute of Medical Sciences in Gachibowli and the Nizam's Institute of Medical Sciences in Hyderabad.
Day by day, we are receiving all these things. We are coordinating with central people, and we are getting all these things, and at the same time, we are distributing to our institutes, which are COVID hospitals.
The News Services Division of All India Radio will broadcast an exclusive interview with Dr. Arijit Mahapatra, Corona warrior from Bhubaneswar, who saved the life of a 1-month-old baby, Gudiya, who was affected with COVID-19, in the Spotlight program. Dr. Mahapatra said that his team of medical staff took every effort to save the life of the baby.
पहले तो बच्ची की हालत बहुत खराब था, उसके बाद हमने उसको वेंटिलेटर में रखा और बाकी सारे दवाई जैसे कि आपका स्टेरॉयड है, एंटीकोआगुलेशन है, रेमडेसिविर एंटीवायरल ड्रग है और ऑक्सीजन है, बाकी सारे दवा की शुरू किया। उसके ब्लड प्रेशर में भी तकलीफ था कि सारे मल्टी ऑर्गन डिस्फंक्शन जिसको बोलते हैं, सारे ऑर्गन में भी तकलीफ। कुल मिला के काफी सीरियस कंडीशन में था। जगन्नाथ हॉस्पिटल और AIPH यूनिवर्सिटी का पूरा टीम है, लगने के बाद हमने उसको वेंटिलेटर से बाहर निकाल पाए और उसके बाद बच्ची ने दूध पीना शुरू किया और सुस्त होकर 20 दिन हॉस्पिटल में बिताने के बाद हम लोग उसको डिस्चार्ज कर पाए।
This can be heard tonight on FM Gold channel and additional frequencies from 9:15 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. Former Director of Press Information Bureau, Chennai, C. Muthavel, aged 73 years, passed away in Chennai today. He was under treatment at a private hospital for COVID-19. He was an officer in the Indian Information Service and had worked in All India Radio, Doordarshan, DAVP, DFP and also as Defence PRO, Chennai. In West Bengal, the CBI has arrested 2 ministers, Farhad Hakim and Subroto Mukherjee, along with MLA Madan Mitro this morning. Shobhan Chatterjee, former mayor of Kolkata, has also been arrested by the central agency. All were accused of taking bribe during the Narada sting operation. They have been taken to Nizam Palace, the CBI headquarters in Kolkata, and will be produced before the court, according to the agency sources. Governor Jagdeep Dhankar recently permitted the CBI to prosecute the top leaders of Trinamool Congress. Chief Minister and Trinamool Congress Chief Mamata Banerjee reached the CBI office a short while ago.
In the Union Territory of Jammu and Kashmir, 2 terrorists were killed in an encounter between terrorists and security forces at village Khonmo in Srinagar district this morning. According to police, the encounter broke out after a joint team of security forces launched a coordinated search operation based on a specific input about the presence of terrorists in Khonmo village. As the joint team approached towards a suspected spot, the terrorists fired upon them. The joint team retaliated, which resulted in the killing of 2 terrorists. The very severe cyclonic storm Taute over East Central Arabian Sea, moving with a speed of about 20 kilometers per hour, has intensified into an extremely severe cyclonic storm. The cyclone is centered over East Central Arabian Sea, about 160 kilometers from Mumbai and 290 kilometers from Veeraval in Gujarat. According to the National Weather Forecasting Centre of India Meteorological Department IMD, Cyclone Taute is very likely to reach Gujarat coast this evening. The Met Department has said that the cyclone is very likely to cross between Porbandar and Mahua in Bhavnagar district tonight as a very severe cyclonic storm with a maximum sustained wind speed gusting up to 185 kilometers per hour. Forecast regarding moderate to very heavy rainfall has been made for coastal areas in Maharashtra and Gujarat and central and south districts of Rajasthan. The IMD has issued warnings regarding complete suspension of fishing operations over East Central Arabian Sea, Northeast Arabian Sea and along and off Gujarat, Daman, Diu, Dadra and Nagar Haveli coasts till tomorrow noon. Fishermen have been advised not to venture into East Central Arabian Sea, along and off Maharashtra, Goa coasts and into Northeast Arabian Sea, along and off Gujarat, Daman, Diu, Dadar and Nagar Haveli coast till tomorrow. Those who are out at sea over North Arabian Sea have been advised to return to the coast.
Our Ahmedabad correspondent reports that 44 teams of NDRF have been deployed in the coastal districts likely to be hit by the very severe cyclonic storm Taute.
Gujarat Chief Minister Vijay Rupani has reviewed the final preparedness of the state in a high-level meeting this morning. More than 1 lakh people have been shifted to the safer places following the threat of cyclonic storm. The shifting of the people from 655 villages of 17 districts are still going on. 388 health teams and 319 teams of revenue officials have been deployed to launch the immediate relief works in the areas likely to be hit by the cyclone Taute. 161 ICU ambulances and 576 emergency 108 ambulances have been kept standby for any eventuality. 10 teams of State Disaster Relief Force along with 44 teams of NDRF already deployed in the coastal districts of Saurashtra and South Gujarat. Yogesh Pandya, AR News, Ahmedabad.
In Maharashtra, heavy rainfall is being witnessed in Mumbai due to the extremely severe cyclonic storm Taute. Reports of waterlogging are coming in from the low-lying areas of Worli, Andheri, Shivaji Park and Pedar Road. The BMC has instructed assistant commissioners of all the 24 wards to be fully prepared to face any eventuality. Meanwhile, the Chhatrapati Shivaji Maharaj International Airport said that flight operations will remain closed till 4 p.m. today. More from our Mumbai correspondent.
Mumbai civic body has deployed 93 lifeguards on all the beaches in and around the city. Besides, even the fire brigade personnel at 7 stations in the city have been asked to be on their toes. As a precautionary measure, as many as 581 COVID patients from Dahisar, Mulund and BKC have been shifted to safer places. Maharashtra Chief Minister Uddhav Thackeray reviewed the situation arising out of the extremely severe cyclonic storm Taute. The Disaster Management Authority informed that over 12,000 people from Ratnagiri, Sindhudurg and Raigad districts have been evacuated and shifted to safer places. Kunal Shinde, AIR News, Mumbai.
In Uttarakhand, portals of the Kedarnath shrine were opened this morning with traditional fervour and gaiety after the winter break. Portals were opened amid chanting of Vedic mantras and performance of other religious rituals. The temple was specially decorated with flowers to mark the occasion. Only priests and few senior district administration officials were present on the occasion due to the COVID-19 pandemic.
Taiwan's government has imposed its toughest restrictions so far as the island tries to battle a spike in COVID-19 cases. The authorities are shutting down cinemas and entertainment venues until 28th of May, while limiting gatherings to 5 indoors and 10 outdoors. President Tsai Ing-wen urged the public not to panic by basic necessities. Taiwan, which has so far survived the pandemic almost unscathed, reported 207 new infections yesterday. The island of 23 million people has recorded 1,682 infections and 12 COVID-related deaths since the start of the pandemic. Now let us take a look at the weather report and forecast for today. The national capital Delhi is having a partly cloudy sky with the possibility of development of thunder lightning. The maximum temperature will be around 39 degrees Celsius and the minimum was 27 degrees. Kolkata is having a partly cloudy sky. City temperature will move from a minimum of 28 degrees Celsius to a maximum of around 37 degrees. Chennai is witnessing a generally cloudy sky with light rain. Upper limit of temperature will be 34 degrees Celsius, while the lower limit was 28 degrees. Srinagar is facing a generally cloudy sky with a possibility of rain or thunderstorm or dust storm. Jammu is having a mainly clear sky becoming partly cloudy towards evening. The temperature will rise from a minimum of 23 degrees Celsius to a maximum of around 36 degrees. Leh is witnessing a generally cloudy sky. Upper limit of temperature will be around 17 degrees, rising from a minimum of 5 degrees Celsius. Gilgit is having a partly cloudy sky with 1 or 2 spells of rain or thunder showers. In Muzaffarabad, the sky is partly cloudy. Temperature will increase from a minimum of 13 degrees Celsius to a maximum of around 25 degrees.
And now, before we end the bulletin, the headlines once again. First batch of DRDO's anti-COVID drug 2-deoxy-D-glucose released. Defence Minister reviews actions taken by Defence Ministry and Armed Forces in India's fight against COVID-19 pandemic. More than 18 crore 29 lakh doses of COVID-19 vaccine administered in the country so far. Over 3,78,000 people recover from COVID-19 infection in the country in last 24 hours. National recovery rate improves to 84.81%. Around 2,81,386 new COVID cases reported in the country in last 24 hours. In West Bengal, CBI arrests 2 ministers and 1 MLA in Narada sting operation case. Former mayor also arrested. In Union Territory of Jammu and Kashmir, 2 terrorists killed in encounter at village Khonmo in Srinagar district. Extremely severe cyclonic storm Taute likely to cross Gujarat coast between Porbandar and Mahua tonight. In Uttarakhand, portals of Kedarnath shrine open after winter break. And Taiwan imposes its toughest restrictions to battle spike in COVID-19 cases. And with that, we end the midday news.